based on an article of Roxanne Kamsey on Henry Brady, a patient with cystic fibrosis. When Henry was born, everything seemed normal. The hospital staff picked his heel to get blood for a routine newborn screening test. Katie Brady, her mother, waited for the result without much concern. But in the days that followed, Henry didn't gain as much weight as other children had done immediately after birth. Then the result from the blood test came back. Inconclusive for cystic fibrosis, referring to often fatal genetic condition in which chloride can't flow in and out of cells normally, causing mucus buildup in the lungs that creates a breeding ground for fatal infections. When Henry was 3 weeks old, his family brought him back to the hospital, where doctors analyzed his sweat. The test showed high levels of chloride, confirming everyone's fear. Henry had a cystic fibrosis. Most of the recent buzz in the field of gene therapy for cystic fibrosis has surrounded gene editing, with systems such as CRISPR-Cas9, a method in which patient cells is directly corrected in such a way that subsequent cells produced by replication carry a working version of cystic fibrosis transmembrane conductance regulator. So the benefit of gene therapy is that it could reduce the symptoms of cystic fibrosis and prevent further damage from occurring. However, it can also be detrimental to the patient in such a way that it could also elevate the symptoms of cystic fibrosis, as well as cause more damage to the patient's lungs. In my perspective, the patient must pursue gene therapy in order to live a little longer and be with his family. So cystic fibrosis is a potential model disease for stem cell therapy. Why? Because of the persistent lung inflammation that leads to damage and remodeling, which could promote engraftment of stem cells.